Sometimes our eyes can take a back seat when it comes to staying on top of our health. But our vision is needed for so many things, and shouldn't we go the extra mile to protect it? Joining us now to discuss is Dr. Charles C. Wyckoff from Retina Consultants of Houston, Texas. Hello, doctor. We are paying a special care to vision this month, as it is Low Vision Awareness Month.
JJ, good morning. Thank you. It really is a privilege to be here with you. I'm so glad that you are helping us raise awareness for this really important topic across the U.S.
Absolutely. Doctor, I heard you say just a few moments ago there are actually hundreds of diseases that can affect our eyes and our vision. Today, I believe you wanted to talk about two in particular that you feel people should really watch out for.
Yeah. Thank you. That's absolutely right. There are many diseases that can affect the inside of the eye. The two most common causes of visual impairment across our country are wet AMD, or age-related macular degeneration, which single-handedly causes actually more blindness, and that's not a word I use lightly, across our country than everything else combined. So a big player. The second one is DME, or diabetic macular edema, which is the most common cause of vision loss among working age people, people like you and me, JJ, with 750,000 people diagnosed newly every year.
Excellent. Well, let's go into the detail a little bit more about those two diseases and what can be done. And is this correct? 4.2 million Americans over the age of 40 are actually visually impaired.
Yeah, a stunning number, isn't it? It really is incredible. And the key with both of these is that early diagnosis leads to long-term visual outcomes. Many of these patients that have DME, or wet macular degeneration, actually begin completely asymptomatic, like you or me, where they're using their phone, they're watching TV, they're driving, and they think they're totally fine. And yet they can harbor a significant eye disease that can cause blindness if not treated appropriately. So it's really important that anybody, for example, with diabetes, get a regular, comprehensive dilated eye exam at least once a year. And it's amazing how many diabetics don't get the eye care that they deserve. Make sure that you or anyone you love with diabetes is getting that annual exam. And then once you're 60, even if you don't have diabetes, make sure you're getting a regular eye exam to look for eye diseases such as macular degeneration that are potentially treatable.
Certainly. I mean, getting that yearly checkup is obviously recommended. What are some of the symptoms of these diseases that you said sometimes people don't even know they have the symptoms? What are some that can occur that people might be able to identify?
Right, an important topic to cover. Thanks, JJ. So blurriness, blind spots in the vision, wavy lines when straight long lines start to look crooked or faded, or dull colors, flashes, floaters. Really, I tell patients anything that's out of the ordinary. If they're noticing any new visual symptoms, A, don't assume that it's just a change in your glasses prescription, and B, don't assume that it's just a normal aging process. Get in, get your eyes dilated, which means the pigmented part of the eye, the iris, gets smaller so that someone can look in the back of the eye at the retina. Because both of these diseases involve abnormalities to the blood vessels in the back of the eye, where they become leaky and they can form abnormal blood vessels that can bleed and lead to scarring. And that process is very treatable, and it's much easier to treat with much better long-term prognosis if it's caught early.
Yes, absolutely. We want to catch it early, and people should know there are treatment options available. So, hey, those visuals you provided really, really gave me a great example of the symptoms. So thank you for those.
Absolutely. Yeah. Now, there are a lot of good treatment options. There's lasers, there's medications that can be given in the back of the eye. All of these should be discussed with an eye care professional.
Dr. Wyckoff, great to talk to you this morning. Thank you for reminding us of the importance of getting our vision tested this year.
Thank you, JJ. What a privilege. Have a good day.
Take the time to protect your vision. This is Low Vision Awareness Month. For more information on how, just visit the website right there on your screen. Regeneron is a proud sponsor of the Morning Blend.